hello and welcome to the HIPAA Insider Show. My name is Adam Zenadine, and today we're going to be talking about AI chatbots and answering a very frequent and even more commonly asked question than the last episode, which is, can AI chatbots be HIPAA compliant? So a little bit of background here. Every clinic, every hospital, every organization, no doubt, more and more is asking this question, or a variant of the question: how do we use AI chatbots, specifically the big three chatbots, LLMs, ChatGPT, Claude, Gemini, without violating HIPAA? Can we use the free versions? What about the professional versions, enterprise products, etc.? So that's what we're going to do today. So let's dive in and ask the LLMs themselves. I'm going to add screen here. And we're going to start with Claude. And I'm going to put in a prompt. Feel free to, play along with this, but I'm going to enter this prompt. Is this free Claude.ai interface HIPAA compliant? The plan that I'm on is just the free plan. I don't have the paid plan with Claude. So let's see what it says. Let's get this up to a bigger. Let's go there so we can see it a bit better. So the answer, no, the free Claude.ai chat interface is not HIPAA compliant. And it gives some more points, some more information here. Claude.ai, the free web mobile interface, does not have a business associate agreement, which is required for HIPAA compliance. Conversations on Claude.ai may be reviewed by Anthropic for safety and improvement purposes, and you should not share protected health information, which is patient data, or other sensitive personal data through this interface. So, that's a pretty clear answer on the free version. It does say if you need HIPAA compliance, you'd need to use Anthropic's API with an enterprise agreement that includes a signed BAA. So I believe the Anthropic API is available on the paid plans, and they will sign a BAA. So that there's a good solution there. Implement your own HIPAA compliant infrastructure and controls, and then ensure proper data handling, encryption, and access controls on your end. We'll dig into these a little bit later. Let's go and ask the same question to another popular LLM, ChatGPT. So is free ChatGPT HIPAA compliant? Okay. Again, no, the free version of ChatGPT is not HIPAA compliant. Here's the breakdown. So there's no business associate agreement with the free version. Same thing that Claude was saying. OpenAI does not sign BAAs for free ChatGPT service for ChatGPT Plus. Then it says data handling messages in free and plus versions may be used to improve model performance. Okay, again, so they're going to be accessing the data that you put in to improve the model, which is, against HIPAA. And then enterprise and teams plans. It says OpenAI's ChatGPT Enterprise and ChatGPT Team plans offer data isolation, so no training on your inputs, enhanced security and privacy controls, potential to meet HIPAA compliance if a BAA is in place. So it says here potential to meet HIPAA compliance if a BAA is in place. So you're noticing here that there's a clear no so far of the two that we've looked at, Claude and ChatGPT. There's a no when it comes to the free versions, but there are solutions that it alludes to when it comes to the paid versions. Let's jump to the third LLM that we're going to be reviewing today, which is Gemini. Now, I already have a paid Gemini account. Working for HIPAA Vault, we're a Google Cloud partner, and we set up Google Workspace and all that good stuff. So I get Gemini as part of my license. So we're gonna just assume that it's the same for the free Gemini. You can go and test that yourselves if you have a free Gemini account. Ask it the same question: is free Gemini HIPAA compliant and see the answer you get, but I'm pretty sure it's going to be the same as the previous two. I'm going to ask it this question here. The prompt is going to be, is paid Business Plus, which is my license, Gemini, interface HIPAA compliant? Yeah, I'm not the best prompter either, so there's probably a better way to phrase that sentence, but let's see what it does. Analyzing. This is using the Pro, so it takes a little bit more time. I guess it does a bit more thinking and reasoning behind it. So, okay, good. The answer is yes. The paid Gemini interface within the Google Workspace Business Plus plan can, again, it says can be HIPAA compliant, but it requires you to take specific actions. And then it goes through what the actions are. Okay, so it says you must sign a BAA with Google, and this is available on the paid Google plans. And then it says you must use the correct services. So there are some services that the BAA that Google signs with you apply to, and some that don't. So it says here, consumer versions are not compliant. The free consumer version of Gemini is not covered. There we go. Oh, the assumption I made earlier was correct, so you don't need to go and try it out. And then the second is Gemini in Chrome is not compliant. So Google explicitly blocks the Gemini in Chrome browser integration for any user who has signed a HIPAA BAA. Let's ask a little bit more about this Gemini in Chrome. Does that mean anyone using the Chrome browser and going to Gemini is not HIPAA compliant, or what does that mean? Gemini in Chrome, what is that? The browser? It's not the browser itself, but rather an AI assistant built directly into Google Chrome browser. Okay, so it's the AI assistant built into the Chrome browser. Okay, so not this interface that you're seeing here, but I believe there's somewhere a Chrome browser, Gemini, because it's owned by Google, so they integrate that into the browser as well. Okay, so avoid using the browser plugin or Chrome inbuilt Gemini, but you can use the gemini.google.com URL. Okay, so we've reviewed these three different LLMs, and we've got a pretty standard response, which is no, the free version is not HIPAA compliant, but the paid versions can be compliant. So what I'm going to do now is I'm going to go into what it takes to make the paid versions HIPAA compliant. We've already seen that a BAA is needed, but what else is needed? So let's run through the checklist. There's a couple of areas that you need to look into. Some of them are related to the software that you're using. So Google's Gemini or ChatGPT, OpenAI or Claude Anthropic. And then others are more related to your internal policies and procedures when it comes to staff and how you go about performing these tasks. So first section is administrative access management. The first item is implement role-based access security, RBAC. What is that? Well, use the vendor's admin console to configure access roles. So when you sign up to any of these, let's say Gemini, there will be an admin console for whoever is the admin or admins on the account to configure the settings. And so they need to implement access roles. Depending on the staff and what their daily tasks are, they'll have different levels of access to different areas of the software that you've purchased and the licenses. The second thing is enforce minimum necessary access. So this ties into the first point, which is minimum necessary access. So depending on what the staff's task is, they will need more or less access. So grant licenses and access only to staff with legitimate defined needs to use PHI with AI. So there's, for example, a staff member that is needing to process large bits of data, big spreadsheets. They want to maybe do some work on the spreadsheets to answer questions about them. Then maybe they would have access. However, someone that was doing less data intensive job would not necessarily need access. And someone within the company needs to, have that control. And when they're asked, when you're asked if you're the admin in the company, hey, I need Gemini license, then, it's fair to ask them, what do you need it for? And then you can apply the minimum necessary access. If what they need it for isn't really relevant, then don't give it to them. Mandate strong authentication. Enforce mandatory multi-factor authentication for all accounts. So that's, something like a two-factor authentication, where it's not just enough for them to sign in with a username and password to the Gemini, but also put in a second factor code through something like a Google Authenticator app. Okay, so that's the first section, administrative access management. The second section is audit, logging, and review. A lot of these will be built into the software itself. So, Gemini, I know, does have the ability to configure logging. And logging is basically just being able to track everything that's done within the business account on these chats for auditability. The second area is verify log content. So verify that these things are captured in the logs. The user ID, so who performed the task, timestamp when they performed the task, input prompt, what the task was, and then output prompt, what was received from the prompt. And then the third aspect is establish a review policy. So this is more of a management administration level task, which is implement and enforce a formal policy. So write something down here for regular review of the audit logs for compliance and breach detection. And then the third section is training and policy enforcement. So you're going to have AI-specific HIPAA training. So develop and require training that includes clear, specific policy on AI usage. There are training platforms out there that you can leverage. If you're already using an HR training tool, then you can probably ask in that tool about anything to do with AI. They usually stay pretty current when it comes to latest technologies and trends. So that would be a good breadcrumb to follow. Then define appropriate use. So it says train staff on exactly what kind of PHI is and is not appropriate to input into the approved AI tool. Okay, so let's say a staff member has a spreadsheet and it has a bunch of patient records, and each line, each row is a patient, and their task is something along the lines of find me the top 10 patients with the most appointments this year. Well, maybe under this, appropriate use, it might be better for them to scrub the spreadsheet before they input it into this AI tool, because if all they need to know from the spreadsheet is who had the most appointments, then the AI doesn't really need to know the names of the patients. That's not what's being asked. It's just being asked for, record A. You could replace patients' names with record A, B, C, D, and then that would be limiting the amount of data that's shared, and it would be more appropriate use. The third aspect is prohibit consumer tool use. So explicitly train and prohibit all staff from ever inputting any PHI into non-approved consumer grade or non-BAA versions of the AI tools. So again, this is part of the training. Let them know that what we said earlier in the video, the free versions, if they can't access the paid versions at home, they shouldn't be using the free versions to do work on. And if they need to do work at home, then they should be able to have access to the work version of their login. And then the fourth and final area is data minimization and prompt design. So some of these bleed into each other. On this, enforce the minimum necessary rules. So this is written into HIPAA law, minimum necessary. Basically going back to James Bond, for your eyes only kind of thing. A minimum necessary requires users to confirm they are inputting only the least amount of PHI necessary for the task, similar to that spreadsheet example I mentioned there, where maybe they need to delete a column because it's too much information. And then the second one is promote de-identification. So train users on techniques to de-identify data before submitting it into a prompt, e.g. removing the 18 HIPAA identifiers. We won't go into the 18 HIPAA identifiers now, but you can Google them. You can ask your LLM about them. And yeah, they're key things to look out for. And it could be as simple as what I mentioned in the spreadsheet, where it's just one column, the patient name that needs to be removed. It could be social security number, passport number, driver's license, things like that. Review data input. Administratively monitor data flow to ensure data minimization policies are being followed and to reduce risk exposure. So again, this ties back into the audit logs, and if you're regularly reviewing what's being inputted, what's being outputted by who, then this will fulfill this part of the checklist. So hopefully that has been helpful. As we've seen, we've reviewed 3 of the leaders in LLM and AI chatbots. The free versions are an explicit no, don't use free versions if you're going to be putting any patient data in. If you're going to go for the paid versions, and by the way, we can help you set you up with the Gemini paid version, HIPAA-Vault.com for more information. But if you're going to be using the paid versions and setting them up yourself, make sure that you're following these guidelines and the guidelines that are provided by HHS, the Department of Health and Human Services. So that's been it for this episode of the HIPAA Insider Show. If you have any more questions, feel free to drop us a comment. Definitely like while you're at it on the video, and you can reach out to us at podcast@hipvault.com. Thanks for stopping by.